I'm Chris with Picture Genetics, and today I'm joined with Haley as a part of our efforts to help raise awareness for breast cancer awareness. How are you today?
I am good. How are you doing?
I'm doing all right. Would you like to introduce yourself and talk about some of your advocacy for breast cancer awareness?
Of course. My name is Haley. I am a genetic counselor. I have a specialty in hereditary cancer genetics, and I am also a cancer survivor myself who is at an increased risk of developing breast cancer as well.
Can you talk a little bit more about the advocacy you do? You're part of a nonprofit, or you work with a nonprofit to have talks about breast cancer, right?
Yes, yeah. So I work for a nonprofit. It's called Tits Deep for Breast Cancer. But basically, we are a group of young women who really promote like education and awareness of developing breast cancer at a young age. Specifically, we focus on women under 40 because that's a really hard demographic to reach, we found. And I kind of got introduced to this nonprofit because I am a genetic counselor myself. I'm also a cancer survivor and I have a high risk of developing breast cancer. And so all of those things kind of came together. And we're based out of Colorado. We do a ton of really cool, outdoorsy work. We do a lot of educational activities. We try to advocate. And we try to hopefully at some point, our big goal is to like reduce the cost of screening because screening can be really expensive. And especially when you're young and you have a high risk of breast cancer, that might not be something that's affordable to you.
Speaking of being young, you would fall into the category of early diagnosis or young diagnosis, correct?
Yes, so I had Hodgkin's lymphoma in my early 20s. As part of that treatment, I had to have radiation and essentially to your chest. And that radiation is actually what puts me now at having a high risk of breast cancer. So I qualify as someone who is under 40 who has a high risk of breast cancer, which means I have to start doing mammograms and breast MRIs and all of those really fun screening things that we typically don't expect to do in somebody under age 40.
I can somewhat relate to that as someone who has family members who had breast cancer, and that usually means that I'm put into a particular bracket for possibly high risk. And for me, doctors have always told me that I need to get screened more often and things like that. For someone else in a similar situation to me, is there anything new that's being recommended in light of more people being diagnosed earlier?
That's such a great question. I don't necessarily think that it's brand new, but I think we have a lot better education about it. For example, even 10 years ago, we weren't necessarily testing or talking to everybody who had a family history of breast cancer. I think a lot more providers now are aware of it. And so for someone like yourself with your family history, or even for somebody like myself with a treatment related history, we know both of those groups have a high risk of breast cancer. And so nowadays we focus on that a lot more, and I think a lot more doctors and providers are just made aware of that. And so having those conversations is probably like a little bit easier. I mean, there's still a lot of barriers, obviously. But being able to talk with your doctor and have those open and honest conversations as somebody who is under age 40 is so incredibly important. And especially with, all of the kind of knowledge base that we have the option of doing genetic testing. We have the option of running a risk assessment with just your family history information. We just have such a broader base of knowledge now. And we know that there's so many factors that go into breast cancer risk. And we can kind of utilize all of that information, basically like a puzzle, and say, hey, what is your breast cancer risk? What do we need to do for you screening wise? How often? What type of screening? And we can personalize it a little bit more.
It seems like we're getting closer and closer to having really personalized medicine,
Mm-hmm.
which is a really nice thing to see.
Definitely.
Talking about screening that are more general, what was your more direct journey? I guess, better question, how did being a GC impact the way you looked at your cancer screening, especially now that you have a higher risk of an additional type of cancer?
That is such a great question. When I was originally diagnosed with cancer, I was actually going through genetic counseling school. And so I was in this really weird place of being a student and learning all about this, but also being a patient. And I think that gave me a really interesting perspective because especially as a genetic counselor, we tend to sit on one side of the desk or one side of the patient room where, we're acting as a healthcare provider if we're in clinic and we're talking about risks in a very abstract manner. When you have an active cancer diagnosis, that abstract is your reality. And I think it just gave me, like I said, a different perspective. It gave me the ability maybe to empathize a little bit differently than I would have if I didn't have a history of cancer. And just kind of allowed me to sit in the person's shoes a little bit more and to just sit with patients. And I think one of the things that I'm so grateful for of being a genetic counselor is that I'm really my own self-advocate now. You get to be that way, especially when you're young and you have, medical trauma. But you also get to be that because I am really, really fortunate to have the knowledge base that I do about breast cancer risk, about cancer risk in general, and to be able to question my doctors about it and ask really, difficult questions or hard questions, and then be able to say, hey, you know what, I know that XYZ or this piece of information related to breast cancer, can you help me clarify this? Or what does that mean for me? And being your own advocate is just like, it's so incredibly important. And it's also it's being your own advocate, or being an advocate in general, is like one of the tenets of being a genetic counselor. We just think about it as advocacy for our patients. And so sometimes, when you're diagnosed with something, you have to be your own advocate as well as advocate for others. I mean, at the end of the day, it was just utilizing like the skills that I had in genetic counseling training for myself, but then also being able to take those skills and, rotate them externally and use them for the patients as well. Because I think that there's like nothing stronger than your own personal experiences, whatever those are, bringing them to the table for the patient, because it just helps you relate at a human level, which we all need more of.
For sure. I've been to, I think it's Southern California GC convention.
Yeah.
It's the first convention I've been to, and I saw a bunch of genetic counselors, and they were like the most empathetic people I've ever heard of.
Yeah.
And like the way that they're talking about like their cases and the way that they like brought all these things, it was like just very whole and complete. It was like, hey, the human existence is really rough, and now it's even worse.
Yes. Yep. Exactly. It's just so critical. And I think it's something that's like missing from a lot of traditional medicine. And I mean, hopefully that's a bridge or a gap that we can bridge.
Yeah, I think it's getting there. I think more and more people are learning like what genetic counseling is.
Oh, certainly.
So I think there's shifts, just in the same way that there's shifts with like personalized medicine coming with like PGX and things like that. I've seen an uptick just like from picture side of like people who are really interested in that testing, because it is such a struggle to go through. On PGX, we have oncology medication that you can test for to see how you're going to react to it, which can be a game changer for some people. I remember family going through breast cancer treatment, and it just threw her for a loop. And if she had something like PGX, who knows if she would have had a better experience.
Oh my gosh, certainly. Especially like, I'm thinking about like my own chemotherapy and like my own treatment that I had. If I had something that was maybe a little bit more personalized to me, like maybe my side effects wouldn't have been as bad, or, whatever that looks like. But I think the strides that we're making in genetic testing, specifically in the hereditary cancer world, are really, really wonderful. And just like you said, incredibly informative. And it's nice to be really precise to the patient, because I think that's going to be the most helpful.
Okay, so as a genetic counselor and as a survivor, what would you say is kind of like the best way to offer your support as someone who was not either diagnosed, going through treatment, or in remission?
Again, a really great question. I think it's so patient specific. I think like you need things at different stages of like your treatment and your diagnosis and what that looks like. And there's just so many different types of support. As a genetic counselor, some of the support we can offer is really just that kind of support of knowledge. I think a lot of people in the Western world find like knowledge is power. And so even understanding like why a cancer happened, or maybe why it didn't happen, or having those discussions of what this cancer means, can be really, really helpful and like really informative. And I think, again, kind of going back to some of my personal journey with cancer, understanding how it happened, or what is treatment going to look like, or what is this going to mean for my family, that's an area that genetic counselors can play a really big role in supporting, of just providing that knowledge base, providing some education, because that can be really helpful. And then there's financial support, right? How do you pay for treatment options and everything like that? And obviously that's something that, you can reach out to different organizations for and everything, but accessing that support is, it's difficult. It can be a barrier for sure. And then the support of just like friends and family, and what does that mean to have support and have like a person in your corner, or like a team cheering you on. I think that from a personal perspective, turn to the people that you love, turn to your friends and family that support you daily anyways, and be okay with asking for help. I think that's the hardest thing. Especially with something as a cancer diagnosis, you get so much kind of like stripped away from you in the sense of like being independent and being autonomous, that asking for even more help on top of that can be really, really difficult. And so kind of, being able to like balance yourself and being able to ask for those questions. And then if you're on the other side, if you're supporting a friend or a family member who has a cancer diagnosis, listen to them. What do they need? Do they just need like a run to get snacks at the moment? Like that might be super, super simple, but it might be the most helpful thing for them. Or do they need somebody to come sit with them through treatment? Or do they just want, a friend to hang out with and complain about? Like, just listen, because that support is going to be so unique to each person, and it's going to change over time. Like, it's going to be so different from person to person, and it's going to change throughout the course of treatment. From diagnosis to survivorship, it's going to look different every day.
I think for a lot of people who are trying to be supportive, it can be a struggle seeing their loved one in pain, seeing their loved one going through everything. And I guess the question that comes up quite a bit for folks like this is, how long do they have to expect to be in pain with their loved one? How long before they can feel like, oh, things are getting better?
Yeah. That's a really difficult question, because, the course of chemo or just cancer treatment in general can be anywhere from months to years. Again, really, really specific on the diagnosis and everything. But I think it's so hard as somebody who has seen your loved ones go through cancer. Like, you obviously want them to feel great. That's why you love them. Like, you don't wish harm on them. And kind of understanding of like, what is this going to look like for me? What is this timeline going to be like? It can be really hard, is to take care of yourself in those situations too. It's something that we think about a lot of, how am I going to be able to support somebody and take care of somebody if like my cup is empty, or if I'm not feeling well? And it's almost like changing that perspective of, rather than saying, okay, how long is this going to hurt me to see them being hurt, to say, okay, they're going to be in this for a while. I need to be there for them. How am I going to fill myself up in these next coming months? How am I going to also be able to show up for them, but then also set boundaries to make sure that I'm taking care of myself? And just like reaching out and asking those questions, because it's not easy to see somebody you love go through something really, really difficult. It's probably more difficult than going through that cancer diagnosis yourself in some ways. And so just kind of, saying, hey, I'm a human. I need to have compassion for myself. I obviously have compassion and love for this person who's going through this, but I want to take care of myself too, so I can take care of them. I think that's really, really important, because it's, at the end of the day, we're just humans. We're doing the best that we can.
So you were diagnosed while you're going through genetic counseling school, but what made you want to be a genetic counselor to begin with?
Oh, a really, really great question too. I was diagnosed as I was like interviewing for genetic counseling school. So I had like thought about genetics prior. I actually did a lot of research in virology. So I was actually working on a couple different like RNA viruses. And I remember saying, I don't want to be stuck in the research lab, but I really like genetics. Like, this is really cool. And my PI at the time was like, you should look into genetic counseling. And I did. I really was like, oh, this is so interesting. This is like right up my alley. This is exactly what I want to do. And so I was literally like applying to school, had started school, and I was diagnosed essentially right before like we do a match program for genetic counseling schools. So I was diagnosed like right before the match program got in. And I just thought, I was like, well, this is kind of odd timing. I mean, one, most people in their early 20s aren't expecting a cancer diagnosis. That's just not super common. And then two, I was like, okay, this is kind of crazy because you start to think like, oh, is this something, is this related to genetics? Like then like the nerd in me kind of came out and was like, why did this happen? You know, obviously I was very much like a terrified 22-year-old and like, you know,
Sure.
very, very stressed. But at the same time, I was very much like, why is this happening? Like, what are the mechanisms behind it? I was asking my oncologist so many questions. And it was just basically like I was trying to learn as much about the disease as I could. The specific type of cancer I had was Hodgkin's lymphoma, which not hereditary. It's like one of the most common sporadic cancers to happen in like 20-year-olds. So again, not anything hereditary or genetic from that standpoint, but since I was a genetic counseling student, I really was trying to like look at it through that lens too. And I think that was like a coping mechanism as well, because what else are you supposed to do when you're in your 20s and you're faced with this thing that you never thought you would have to face in your life?
Yeah, it sounds like having this diagnosis made you more empathetic, it made you more understanding and all of that, but also sounds like you really went down a rabbit hole to try to have like control over what you were getting.
Certainly,
And
certainly. And I think it was like I wanted answers, and like thinking about it now, you know, that was over 6 years ago. Patients want answers. Like that's just what we want, is we want to know why, how something happened. And that was me. That's what I wanted to know. And I think it made me a better genetic counseling student at the time. I think it, you know, strengthened a lot of my genetic counseling skills because, like I said, I've had that, I kind of sat on the other side. But yeah, you really become an investigator. And both patients are investigators. I think genetic counselors and other oncology providers are investigators as to why and what made this disease happen. And it's just kind of a lot of clinical genetic counselors are trying to bridge that gap through genetic testing, through education, through knowledge. Whatever they're trying to do is, you know, bridge the gap between what patients are investigating, what we're investigating, and, you know, how can we make that a cohesive statement for them. Yeah, it definitely put me on like, I just remember being like, this is something that I want to do because I would like to help myself, or I would like to help people in my shoes. When you're in your early 20s, you don't think about cancer as being a possibility. At least I didn't at the time. And so I want to be able to be somebody to help someone and to basically say, hey, like, I know what you're going through is really, really scary and you're really young and this is unexpected. But we can walk through this together and we can find that education and find that knowledge, and we can just sit and say, hey, you know what, this sucks, but we're going to get through it and we're going to do it. And so being that support and being that advocate for somebody is really important to me now, because I know that I was so grateful for the people who were my advocates and supports when I was going through it.
so you give a lot of talks about breast cancer.
Yeah.
What does that usually look like, I guess?
Yeah. We are a little bit outside of like the standard box, I would say. So we just actually recently did 2 different events. We did like a rafting event and a mountain biking event. And so for mountain biking, we focus on all women. So we had all the ladies come register, and then we give a panel basically of different people who have just different perspectives on cancer. So our most recent panel was myself talking a little bit about the cancer genetics side of breast cancer. We had a breast cancer survivor who's also an OBGYN, who kind of gave her perspective, again, as both a patient and a provider. And then we had another breast cancer survivor come out and just kind of give her story. And so they're very casual talks. You know, it's really fun because we are all in like our mountain biking gear and we're just having these really like serious conversations while like wearing glitter on our face. And like, you know what I mean? It's just a really great time. And we're just like talking about what it means to have a high risk of breast cancer. And then we're going to go, you know, like ride the mountain later and like get muddy and dirty. And it's such a cool juxtaposition because so much of cancer knowledge is like based in the medical field, that for us to kind of bring the medical providers into these outdoorsy spaces is really, really wonderful. Like, we went rafting and we're like singing songs and just like having this wonderful time, and had a potluck and picnic after, and then got into like really good conversations of like, when should I talk to my doctor about this specific screening? Like, is this right for me? How do I ask them about that? And it's just a really, really great way to kind of like, I think, make cancer more digestible, or just really to make cancer easier to talk about and like reduce some of those barriers. Like, we can have a good time, we can be serious, and just having like that environment of having all women get together to talk about this is really great, because we're pulling experts from the field. You're also just like pulling people who have a history, have a family history, a personal history, and like all of those perspectives are so important. So yeah, we just have a really great time. And being Colorado based, and really being founded after one of our late friends who was diagnosed with breast cancer, we have a focus in the outdoors, because that's where a lot of the women meet, whether they are snowboarders or skiers or mountain bikers or rafters or rock climbers or whatever. We just kind of meet them where they're at, which is usually the outdoors. And I think it's the best way to provide education.
What is something you wish more people knew about breast cancer, or you wish were discussions that we're having around breast cancer? What is something you think that are missing in the bigger conversations that you really want to emphasize?
One thing I hear all the time is breast cancer from dad's side of the family still impacts you. Breast cancer risk can be increased even if it comes from dad's side of the family. You still need to talk about it, still need to bring it up, because both sides of the family are really important for that risk. Whether or not it's known to be hereditary, even just that familial risk is really important. And then the other thing that I'm so passionate about is just getting checked when you're young. And like, if you notice something, talk with your doctors. Or if you have a family history at all, ask your provider about it. Because there are so many women who would qualify for high risk breast cancer screening under the age of 40, solely because they have a relative in their family who was diagnosed at a really young age. And I think that not a lot of people know that, where they're like, oh, that was a one-off, or maybe, she was diagnosed because of XYZ reason. Maybe it was environmental, but we can't rule that out, right? We want to make sure that we're screened. So biggest things, your dad's side of the family totally matters. We want to make sure to include his whole family in those risk assessments. And then the second thing is, if there's any young breast cancer in the family, and really, if you have questions about your breast cancer risk, talk with your doctors. It does not matter your age. You can ask them questions, because sometimes you might end up being on that higher risk end and need to have screening under the age of 40.
I guess a question that might come up is like, how young is too young? It's like, I'm 18. I don't have to worry about this at all.
Yeah, really great question. That is something that's so focused on the family history, because we talked about a lot in clinic. I used to work in hereditary cancer for 4 years. And somebody who's 13 probably is not going to have enough breast tissue to even consider breast cancer screening, right? But if we have a family history of 25-year-olds with breast cancer, we're going to want to do something. So I always recommend, it kind of starts with like the family, is when you're going through puberty, or when your children are going through puberty, talk with them about it. Talk about what normal, healthy breast development looks like. Then also talk about, hey, we have this cancer risk in our family. We want to make sure if we notice any of these signs or symptoms like itchiness, bumps, redness, swelling, ask me about it. Ask your doctor about it. I think that education that starts the younger it is only going to be more helpful, because when you're a teenager and going through puberty, you don't know what's supposed to be like typical or not. And so having those conversations really early on can be so helpful, because then you're just aware of that risk, and that's going to just make you more comfortable down the road. I think the end all be all is, it's never like too young to really talk about breast cancer risk, though at some point a person might not have enough breast tissue to really be considered at risk for breast cancer.
So men get breast cancer at a significantly lower rate than women, generally speaking. Is that because of breast tissue like availability?
Yeah, I mean, in part, it's just if you don't have that organ or that tissue system, it's going to be really hard to develop cancer in it. Part of the things that can impact breast cancer risk as well are our hormones. And so, like, typically estrogen and progesterone can increase that risk depending on levels, depending on lifetime. There's so much data and science out there about it. But generally speaking, people assigned male at birth have lower estrogen and progesterone levels than those assigned female at birth. In part of that reason, they also don't have as much breast tissue. And so that's why part of the reason that we can see significantly lower rates of male breast cancer. But men who have pathogenic variants in BRCA1, BRCA2, or other hereditary conditions, we do offer mammograms for some men, just kind of based on their own personal history, family history. And so we would consider screening men if they have an increased risk of breast cancer based on a hereditary factor.
Generally speaking, AFABs will get, if they know they have a high risk, they'll often just opt for a full-on vasectomy. Now, does that eliminate the risk or does that just reduce the risk?
Oh, essentially reduces the risk as much as we can, right? We can never say that it's going to be 0% because quite honestly, we can't say that we got every single breast cell when we do a mastectomy. But it eliminates the need for screening. And I think that is the biggest thing that a lot of AFAB individuals are looking at when they want to reduce their risk as much as they can. A prophylactic mastectomy is going to be the way to do that. There are some instances of people who have gotten breast cancer after a prophylactic mastectomy. Really, really rare, few and far in between. And our surgeries have gotten better over time, right? But it doesn't necessarily say that like, hey, you're going to be cancer-free for the rest of your life, but it means that this really high risk of developing breast cancer that you were born with, we've now reduced it as much as we possibly can. And I think at the end of the day, that's, what a lot of people are looking for anyways, is like, hey, I want to be able to reduce my breast cancer risk. What's the best way for me to do this? Right now, we have prophylactic mastectomies as one of the number one options.
Through diagnosis, through treatment, through remission, what would you say was the most direct help that you personally received?
Yeah, some of the best help that I received was actually from my track teammates at the time, because I was diagnosed right at the end of my undergrad, and having them just like reach out and support me was really, really wonderful. And basically that support was just like texting me and asking me if I still wanted to do typical things. Like, did you just want to go get coffee? Do you want to see a movie? Do you want to just hang out? Like, being reminded that you have a life outside of cancer was so helpful and so important, because it was so much of my identity at the time that I didn't know like how to exist outside of it. And so just having friends and family wanting to do normal things was really, really great, because it made me feel like a regular human again, and it made me feel like who I was and myself. And then the other thing that is like probably so silly, but like eating like candy and different snacks was really important to me. So whenever friends would send me like candies they were really into at the time, it's like such a silly small thing, but my specific treatment took my appetite like fully away. So like whenever I could eat, I would try to get food down, and if I like had something fun to look forward to, like that was really great. Or even like the treatment I had, like it made my mouth just taste really metallic. So like always having some sort of like candy or just like something like that was like nice to take that away. So like such silly things of just like, I wanted to be a normal human and I liked candy. It was like basically reverting to being a toddler. But yeah, and just checking in, and you know what I mean? Just having those friends who are like, hey, how are you? What's going on? And like creating that space to say, if I was having a bad day, to be like, I'm having a really bad day. It was really, just like showing up. I think that's the biggest thing, is just like show up for your person, make them seem normal, make them seem like a human. It's weird. Cancer is really weird, but they're, at the end of the day, they're just a human. Like that's all.
It sounds like you got, the ice cream after getting your tonsils.
Yes, that's literally that, but like tenfold. I'm pretty sure. like post chemo and I got like my stomach back and I was like able to eat things, I was like, I just want pizza. Like I was like, I just really want like a full cheese pizza, which is like such a silly thing. And I was like, yeah, I just want to spoil myself.